Hey, murega, mwiroreri wakwa. Karibu tena katika this video ya na Su Mwangi haria twararagiriria uhoro wa kuruirira higo kana na Su Mwangi fight for kidneys. Lege I'm a nurse by profession na dutaga wira kundu kwa I manage a dialysis clinic where I've been doing it for over almost 5 years now. And omothere ndirenda gukatwariririe uhoro wa depression kuri andu aria marwarite higo. Na uhoro uyu ni ndirawaritie ringi ni ukuona he channel ingi ndirawaririe no umuthi ni njokire ndeuria atiriri ni andu igana aitu magĩigua rũthiomi rũrũ maranyitwo ni mena mũrimũ wa higo na rĩngĩ matiramenya they are also ni depressed. Na ũrĩa tũrarũĩrĩra ũhoro wa higo ena right now ndirĩ ndakena toria ikiuga ngenete kumia 2020 coming to this year ati ũhoro wa higo nĩ wĩkĩrĩirwo kĩo mũno all over the world. Uhoro wa gutikira higo, uhoro wa kurehe technology igukorwo igitikira andu aria marwarite mirimu ya higo magie na care iria yagiriire, magie na quality care and affordable care, na ati andu mahote gukinyirwo ni uteithio no matter where they are in the world kana haria hothe mangikorwo thi ciothe. Riu we uria uracokire ugacoka ukandehe ugaigua uhutitie kana unitachite ni uhoro wa depression, because ni uhoro ucio ni ndiwona kaingi na kaingi na ni ndi mundu wa kwaria na andu koguo na hindi iria managing always ni thia kuona aruaru akwa na kwenda kumenya uria mahuana, kumoria how are things going, ni uraigua atia, na especially aria matuika eru dialysis, aria matuika eru marajia dialysis kana kidney ciao ni ciafirite and they are still trying. Ayage, if they have been there makoretwo kwa miaka miingi already they have gone through the phase, probably they got ni overcome it. Nobody can overcome that kind of life ati ugeru ni daiga. And some people, yes, they probably ni understand that this is me and maya nimo maisha maria dinamo haha na dikoreka wora uria ndirathie kahinda-ini gaka ka dictate life yako, of which that's the best mentality mundu wothe angikorwo enaguo oige atiriri ati angikorwo ni ndigo ciakwa ni cia fail ri na nguni guthie macini-ini niguo njikare matuku maingi ri ndikureka uhoro wa macini unjohe no ni ngwiciria ni ngureka nyone life the other side. I see the other side of the career ya maisha na that Mechiria tamau ni mateithagia others. No, on the other hand kuri andu angi magutuika na murimu wa matuika ngoro ciao ni ciatiga kuruta wira, ni magutuika ati ru mari maintainagwo na machini makaje kuona maisha ni mathira ati riu life yao ni yacenjia and this is end of life. And haha niho haroka andu acio magatuika depressed, na matuika depressed haha niho ndiroka ngamwira atiriri thina uria munene muno mundu wina murimu wa kidneys atuika depressed, the symptoms kana symptoms, I can't think of the word symptoms in Kikuyu right now. Guga mawoni, I don't think that's right. No. Okay, let's call it symptoms. Mundu wothe ni aramenya no amenya ukondu ucio ungira mundu ucio ngiri ido maundu maria mwiri ukuigua God maria angiigua thina wamo ni ati uria mundu higo ciake ciaga kuruta wira ria ciatiga kuruta he maundu maria iguaga na nimo matuma andu aingi mathie kwi ndagitari na mundu depressed ni aiguaga maundu o maya and nitukwariria maundu maria aiguaga ru maundu macio aiguaga ri wathie kwi ndagitari angikorwo higo ciaku itiraruta wira haha ni hakoragwo na hinya muno wa ndagitari gukwira ati na ni mai mundu ni depressed until you go ndagitari wahota guthie kwi ndagitari akorwo ndagitari uyo ni ako dismiss. Unfortunately it happens ona kuona kuri andi ni uthia kwi ndagitari ukamwira ni uraturwo handu na maga ku dismiss na gakwira ati nduri na ruo we ni meciria ona ndanagikwi onako ni meciria ndanagikwira ati riri kinywe tutawa tutu. So it happen sometimes wage guthi kwi ndagitari ugwiciria outside the box kana akorwo ni ena kiu mundu na igiate tareke turore kina hi hau niho gutwika diagnosis. Riu nikio ndiroka haha ngakwira atiriri ati no ukorwo na wina urwarite higo na ni uraigwa maundu maya na gutire kana ukorwo ni urwarite higo no uraigwa maundu maya no nduramenya nginya we depressed. Kogo ni uguthi wire ndagitari atiriri hai ndirakurehe haha niguo hote wathi kwi ndagitari uhote kwiyaria no korwo nawe na tondu handu andiaragiria o andu aria marwarite murimu wa higo njaragiria mundu wao mundu wina mwana wake mundu wina muthuru wake mundu wina mutumia wake mundu wina sister yake mundu wina mundu marutaga wira nake mundu wina cousin yake mundu we healthcare uraini aratikira kia ya mundu we dialysis na mundu ucio ni adanania symptoms ici. Please dig deeper na umurie wajie kumthikiriria mundu ucio na muone uria mundu ucio angiget uteithio itanatwika worse so like igugite bereri ukoragwo ati it's very very hard ni uritu muno gukorwo na depression kwi mundu WSRD ku diagnose na depression kana gutwika ni amenyeka ni depression yenayo na ni undu the symptoms na haguga na githugu the symptoms iria makoragwo nacio ikuana o tairia cina mundu symptoms isi ya depression na mundu wina murimu wa higo simefanana kabisa hatire difference ni the same. So let's say for instance na nici ni go highlight agikorwo mundu rwarite higo ri kindu kimwe athiaga akaigua ndakomaga ahota kuigua mundu igiate he ni ndagitari ri mimi nimejaribu kulala na jaribu hii ndathie toro ndoraga gitara mafati. I remember in high school in primary school aria mathomire na kuria gicagini ni toigaga atiriri twataraga ati okondo na understand subject ukaiga ni da tido muthi gitara cyber science. You remember those iron sheets that had a cyber sign? So mundu akomete ndanakoma utuku the whole night ati ndarorete mafatio. Well, no korwo gwaku kwina gypsum ri wagitinda urorete uguo naona he handu halarik na do nakoma you're not sleeping anyway. That's what I'm trying to bring you home to understand, like you have been up watinda we macho the whole night watara gwiciangania ni ciriko ikugambaga utuku nugereire hau akiuga niki guthire the whole night you are oratos ndurahota gukoma iyo engiri ukaigwa you lose weight you're losing weight na nduramenya niki and rukerwa ati even mundu wina murimu wa higo ringi ni marusagi weight tondu matirahota kuria ni marusa appetite they cannot eat. Here you are also here na ringi ni maigaga atiriri and depression people mundu wina murimu wa depression people find depression in different ways nigua mostly na nijigua muno they start people say ati they depressed. They depressed. You see depression, hiyo ni stress. They depressed. No murikate, hey, nilikuwa depressed. Nilikuwa nakura. That's you. Kwi mundu ungiotwikaga depressed or depressed and matiriaga, like for instance, get depression, but you can stress, really, I don't eat, but go gakoma deshiragia gatoro tu o gatoro, don't wanna do quimodo game. Depressed or stressed, ruturari horo depression, forget about stress, but modo uria depressed akaga dararia akarus weight dari no dware da gwika gutiri ndo nati araigwa wa gwika arenda kuigwa mimi staki ugacoko kona atiriri mundu depressed agakorwo dari na energy. Same thing, modo wina kidney failure, they were dari na energy, you know, they are fatigued, their body does not even have oxygen, they feel like they can, because of nyodo wa nyamushita go red blood cells, mwere wa modo cio wagite kidney ciake itararuta wira ri niakoragwo akiaga mwiri wake ugikorwo githondeka red blood cells. Na andu aria murarikana biology kana uria mwathikiriirie githomo kiu kingi ndamuthomithirie, agikorwo kidney ciaku ni itiraruta wira na mwiri waku nduhota kidney ciaku, if they are not working, then nduraruta red blood cells, na red blood cells iteithagia na riri gukari oxygen mwiri waku. Na angikorwo na nduri na oxygen, then you feel even tired, you can breathe, you know. If you don't have red blood cells, you are tired, you know. Rumundu isiwa na ndari na low energy, unaona common kawaida ESRD kana murimu wa higo higo ciaku itiraruta wira wina icio symptoms, then you woka haha we depressed, ndiraigua mona gwika undu we ni uria andu, you know, tindaga nyumba uhinga katini ugatinda toro, you know, nduri na energy, but that one now it's depressed. So they haha karehe thina tondu the symptoms are the same. Uguo niguo ndenda kumuonia haha, the symptoms are the same. And then wacoka ugakora atiriri mundu uyu ri arathi kwi ndagitari, you feel like you get some pain, you know. Same thing, mundu WSRD araigua mahindi make mena ni maratura, you know. Then uyu ungi we depressed they are in a pain, na pain ri ona ndangihota go pinpoint athi aria ndagitari ni mutu uratura. Depression they bring irehaga pain, a pain that ni uraigua ruo, no ruo ni mental. Wathi kwi ndagitari ona ungiruo ni ndagitari pinpoint ukaiga atiriri hey, denaruo, and the doctor is asking you, can you pinpoint where the pain is? No ndungihota kuga haria ruo ruri, no wina ruo mental, na ni ruo rurakugiria nginya ukome, wageria kwigarura, wageria gwika atia wina ruo, but you cannot pinpoint. Ndungihota kuonania ni ha ruo ruri, ndungiuga ni mutwe, ndungiuga ni kuguru, ndungiuga ni ha. Same thing onake mundu wina murimu wa higo ringi ni araigua ruo ona nake ona ndangi pinpoint, because of the way the body is changing, the hormonal changes, all the toxins in the body, you know. They have a temporary it's called temporary, where what is it called? So you have all these toxins in your body and you get agitated. It alters your mental status. So it's hard kugatiriri ikasenjia uria mental hakiri ciaku ira function in you do all the toxins that they have built. I cannot think of the word right now, but mudoshio, you know, akaigua, you know, agoka agatuika depressed, but really that's the toxin itself on a normal ESRD patient. Then you ugoka mundu yugi wina depression, you know, nake ane araigua the same thing. Anxiety. What's the cause of depression? People, they face depression ni gukorwo hari undu ura face kana hari undu uonete maisha-ini maku. You could say financially, you could have no korwo uthiete loss ya mundu, somebody you really loved, say ni urathire, or if it's a mother arathi ararusi mwana wake. So that anxiety kuigua makite higo cio theki, you know, that one so that one it cause you to become depressed, you know, whatever gutwika na kiundu kiria ura face in life yatuma utwike anxiety, uge na anxiety, increased anxiety, tondu reciria kiundu kiu ni gikuo happen ringi, kiundu kiu ni gikuo happen ringi, kiundu kiu ni gikuo happen ringi. Let's say for instance mundu hota kugia na bad accident, utwike anxious ati hiko ciothe urathi na ngari ureciria uria ngari ukugia accident, uria kugia accident, and you become depressed. You know, that increased anxiety is a symptoms of depression. Now here is another person where a normal person, they might not be depressed, and munyitio ni mundu wa rwara murimu wa Wahigo, ruwe anxiety yake yoka atiriri ati hey, now ni nderwo kidney ciakwa ni cia fail, ni nderwo ni ngwambia dialysis, ni nderwo ni nguthie njikirwo tube either githuri-ini, nda, kana guoko gwakwa ni gugutemwo guconnectwo na kindu kingi, ni nderwo ndingiria kina, ni nderwo ndikihota ndirirutaga wira thiku ici na ici, ndirihota gwikona o ndingiria kina na kina, you know. Oh, and then ukorwo ni urariha dialysis. So you know, all these things that you don't even know induce that anxiety of the unknown and the worries of that's a new ESRD patient. Can you know wagena anxiety kiu. But then so that anxiety of the unknown yoka yatwika too much, that person become depressed. But then when they go to the doctor is saying you are anxious, you know, because agukurora kwire atiriri ai ni undu no ko ni undu you anxious, you know, ni hindi urabirio dialysis, it's a new thing, the mundu ajia go comfort, but really you have really become depressed just because you are you have another undiagnosed depression. Okoro hi wari na depression man, you know, there are so many forms of depression that even in your family, that runs in your family, that onotare warwara ESRD, you had it but you never thought about it. No runyodo wa stress iria yogererwo ni ESRD, no yatwika full blown, you know, you're feeling all these things, and really it might not even has to do with dialysis itself. No nyodo with not to do with dialysis, I keep saying dialysis, but not to do with your tioduna ohoro wa kidney failure. Already you had that depression. No one having a kidney failure. So they did at these things we're depressed na when a kidney failure ekaga kumenyeka. Oshioge kuiguaga, you know, you feeling powerless, you know. Really you have a natural depression, let me say that. When you kore that Murimu depression, you have it in your family, that trait, you know, and it could be different forms of depression. But here also woka haweru atiriri we ESRD weru atiriri okay ni ugwikona ni urithiaga kwa dialysis, ni urigagwo ni machine-ini, he mundu urigutikagira kia, ndukaruta wira, ndugekona, and if you are the breadwinner kana we muthuri urehaga mbeca muci, kana we mutumi ureha mbeca muci, na ni werwo ru kidney ciaku ni cia fail, ni guoka that one you feel now ndungihota go provide to the family, you know, you feel you are really, I can't take care of myself, I used to ndiraturite njikite maundu maya mothe ru ndingihota kwikira, and so that one is another signs of depression, that mundu ni akoragwo with depressed. Normal depression, you feel that way. Mundu uria warwara murimu wa depression kana nduri na kidney failure, if you are normal person, yes, a regular person, like a normal person utari na murimu wa kidneys, agikoro mundu ucio ni ena depression, no akorwo na depression, na ru haha ni woka mundu wina murimu wa weru wina murimu wa kidney failure, na ru ni ena maundu maya ni araigwo nona uredagiria, it's hard ona ni ku explain, it's really hard kugatiriri how hard it is to diagnose somebody to symptoms ici ara present na if dare na history ya depression, dare are diagnosed in the previously because of depression, then no akorwo ni ari na depression in the past and this is not is ESRD, it's just that ESRD ni atuike outgrown, you know, of yeah, ni atuike, yeah, is it outgrown, yaimanira o yaimanira pio. Then say modo depressed, aiguaga atiriri ndarenda guthii handu, ndarenda interact na andu, ndarenda atia. A normal depressed person, that's signs of depression. You don't want ndurenda gutungana na andu, mundu cienda guikara nyumba gwake, wathie kati nikoragwo ihingitwo throughout, wathi gwake ni nduma, athie akiroraga ndarenda gutungana na andu, ndukamuona kundu we nie ikarie. Then gugoka mundu uyu wagia na ESRD, ena murimu wa ESRD, ena murimu wa kidney, na no tureda end stage renal disease, na ena niagia depression, niodu nierwa atiriri, you can do all these things, you know, this or that pressure that do ona digathia no ko mundu uyu niaraturaga thiaga handu na hwaini na thuri magathi makaheo mwe. Now you are like, okay, I cannot drink, you know, nwerwa haha ukaika I cannot drink. Kana niarathiaga, say, I like to use the word golf because, you know, those people who are retired, they or they have these jobs and they go golfing after work. And now ndangihota guthie golf tondu if ni maintain wira ri na no makeke dialysis okwareka dialysis mushiri no makathie ke dialysis mushi kana okwareka dialysis no makathie hwaini ageke dialysis. So you see the normal maundu maria marekaga ni macenjia. So there's that pressure, akaigua, now I can do it, oko ni marathia fishing, akaigua this time I can do it, mathia muthenya muna, oko ni go travel, they used to travel, you know, you feel, nyora makaigua ni mara inconvenience andu aria angi tondu oko ni aguthie dialysis ri, oko ni athi dialysis, then no mhaka I figure out how do I do how do I have to make arrangement uria geka dialysis, kogo if I have to travel with the family, I have to travel with the friends, na maundu tamashu. So there's that pressure. Pressure being in dialysis, but also ne depressed, na ni araigua ndangihota kuma kuri andu. You see, that's pressure from now yes, I have all this, I can't do it because the dialysis is restricting me from doing this, or my kidneys failure is restricting me weka maundu maya. Feeling hopelessness, like again, you feel powerless and you feel hopelessness. You feel hopeless. Okay, gua turi udugi ni okay yaga ukona nieri gutiri udu. Same thing with dialysis, ni ukwiyaga kana we kidney ciaku cia feel ni ukwanjia kuigua that feeling, but then ukagia depression, you feel the same. But when you wathi kwi dagitari wamu explainira, dagitari akwira ati ai ni hindi uragitwikire wa uradiagonize na murimu wa higo, na iyo ni kawaida, mundu ni iguago, you know, it's those things ona ringi mandungihota ku express. So niki ndirarehe uhoro uyu ngaiga atiriri, depression is major, it happens na the andu aria marwarite murimu wa kidney, the studies has shown andu aria makoragwo na murimu wa kidney makoragwo na high rate ya depression. And the unfortunate part ni okay, andu aria makoragwo marwarite murigo wa higo ni makoragwo no na cases ni makoragwo mari mena high risk, ni magia na depression gukira andu a normal person wina mirimu ino ege, like murimu wa cancer, murimu wa these other conditions. Kogo mundu wina murimu wa higo ni akoragwo na rate nene ya gutwika depressed than mundu urwarite mirimu ino ingi na thina ukoragwo ni atiriri ati mundu uria urwarite murimu wa higo no age kumtwikania no age kumenyeka ni depressed ni undu maundu maria symptoms iria angikorwo akira ndagitari wake no the same symptoms mundu symptoms iria nacio no cingikorwo na mundu wa kawaida wina murimu wa higo ciake ibirite na akorwo na ndari depressed tondu to muhaka ati mundu wothe wagia higo ciake cia fail ati no muhaka atwike depressed although andu aingi ni magiaga to ti 100%. So let's say it's a 90 something percent andu aria mena murimu wa kidneys higo mena murimu wa higo ati matwika depressed kuri aria makoragwo kuri angi matatwika depressed. So no onaya matari depressed maraigua all maundu the same maraigua the same symptoms ni undu kidney cio itiraruta wira koguo ri riu ndirenda kuga atia ni undu wa gukorwo na ati andu aya mena murimu wa depression ri ni magiaga ni matwikaga a guthie thibitari kaingi makakona mirimu mingi tondu ona ni mararemwo ni gwitikira kia tondu angikorwo igwa we hopeless powerless you are full of anxiety ona ungiuka ndagitari akwire niguo ranidi gwika niguo hindi ria urwarite murimu waku wa higo no mwaka make sure uraria diet huana atia no mwaka make ni ora exercise no mwaka uthiage dialysis maundu thiku ciganona mundu uyu watwika depressed riki no age kuruta maundu macio na angikorwo ndara follow diet iria agirirwo angikorwo ndarathi dialysis maita maria agirirwo guthie angikorwo ndara for the prescription iria eritwo ni ndagitari ri say okoni agirwo kunywa dawa ici cietagwo phosphorus binders ri that means phosphorus yake gukorwo i high kidney cia mwiri wake nduratwika cleaned koguo ni agutwika wa kurwara muno koguo agathia thibitari kaingi then ni macoka makoiga atiriri ati outcome yaku kana uria ugu survive lowers tondu angikorwo we depressed the same thing dura take care of duretekira care durathie dialysis uria wagirirwo follow ndagitari orders cia ndagitari tondu ni uraigwa ni we yumire tondu we depressed ni uraigwa you are hopeless you are powerless you feel of anxiety and you feel you really don't want to do anything ni uraigwa nogete ni uraigwa you have this anger and I see it a lot. Okanado yes, they have such an anger na nigoje thomithagia na ni encourageaga adu aitu jugagate yes we have to accept at patient okay akurume na waitikire you have to we put guidelines umere no this hahatiho onoko we murakaru we ndungioka kurumana guku ndungioka kurehe haro you see those people they wanna ni marenda kurwa all the time na ni ti undu ni marakaritio ni andu aria maramarutira wira kaida kaingi marakarite nio they are depressed and they have anger because depression ni uka na andu makorwo na anger again. You feel to understand. No other worry mundu amuria today. Hey, how are you doing this morning? How was your day? Okay, gwa mundu ucio akuria today. What's wrong with you? And probably tenene that we got offended. But now I'm like, hey, okay, you keep quiet, and I'm so sorry. This morning I didn't feel like myself. Okamenya, Modosho, they have anger to themselves. Makona hariodo nigie kiriona. And that one, that's part of depression with ESRD. And sometimes people walk away without knowing that they are depressed and they don't get the help. They don't get matiheagodawa, matituikaga treated because they don't even know. Like I said, they also have low quality of life. Modo depressed, for sure Can you imagine those people will not brush their teeth? Matietha baga, matishejagia guo, there's so much really on a wera modo depressed umwiraka gukaingira gutuguku gukoimira gutuguku kingi, and you see on a you see it ukona modo who was normal aroka now ukona ni ashenjia, like the depression then kicks in. Mudu mwerora reru ne hide a kidnisha kenisha feel ero ni aje dase ukona mudu sio kaga wega. The next thing mudu sio madareja jui, if it's a man ukona dareja juire dareja deru da juire da darate krake ukona ma toothbrush men. Guys, I'm talking real. Ukona toothbrush nyariganirwe ihutagio atia wa muthikiriria mundu ucio ona deodorant na ini America a deodorant mundu ucio na ndari eciria deodorant ikagwa wamenya ukamuthikiriria ukaigwa mundu ucio probably athiete 3 weeks atari ethamba wa mukuhiriria uguo ukarigoka ni kugwa kana ni gukira gukira. So, but thing, it's like that person is depressed. Na ona kioge mwira, okamwira ne depressed, okamwira, I think are you depressed? You are asking, okamuria shurisho, and sometimes they also go on denial. So, my kurehe geke ni atiriri, niko mumenyithia atiriri, ati no ukorwo na murimu wa kidneys na utweke depressed. Kana ukorwo wina murimu wa kidneys and already in your family ni kwari na history of depression, no ukorwo na doi, you know, you dwari na stress irahotire go trigger that depression. Todo mwiri witu ri no ukorwo we have a threshold kana he haria o stress igigutwara to a certain point, you know, everybody modu wothe niari a threshold haria ati ugithi up to this point. But when you get why you take at a normal person, yes, they have a threshold up to a certain point. At no, they up to this point. No, they washoka watu ikawero ni watu ikamurimu wa ESRD. No aje kwirwo ni urithia ka ukari habesha shigana ni uguti nduri hota kuruta wira ni urikagio machine ni aga ni uri ona thakame mundu tari wona thakame, and people are scared, you know, mundu tari wona thakame ona thakame aka faint na ru ni werwo thakame rirutagwo mwiri ikakererio machine ni ati guikara mathaa mana wiroreire thakame, you know, on a machine igisacurate igishoka mwiri waku na mundu ucio ndari ona ndangiarorire thakame, you know, that one just the kuigua uguo it triggers agikorwo ni ari na murimu. A normal person wari na history ya depression, but there that stress ru ekutuma ru depression kick in lile yokirio hari etokirite. Kana you a normal person that has no history of depression na nierogo, then it triggers and the stress, they can hold the stress and they become magatuika depressed. So how modo wina murimu wa ESRD, the first step ni ko recognize, na nikyo haha ndiroka ni ko recognize uhoro wati we depressed, you know, kweyoria this is kawaida na kuwaragia. Make sure ni uraria na ndagitari waku, no matter how my ona maga gukuigua, talk na niye nejera modo atirene. At the same time, build a relationship with your doctor. Usiwe una jump from point A, uradhi kwita gitari, especially okoro your kidneys have failed, you need to stick na daktari mmoja, mwambie umenye daktari uno menu orago treat. Na oko nuwe igua uyu daktari ni murahota na ni arago thikiriria, ni arago understand, stick to that, stick kwi daktari ucio. Niguo na wa mwira undu ni arigo thikagiriria, ni akumenyete now. Ni arithiaga kumenya. Then ukaenda ariana family members, let them know uri oraigua, let your friends know. Ona aria ona okorwo we ha uko na uyo boss, that ukorwo na boss yo ucio waku utironanaga eye to eye, and you still have to continue kuruta wira. Please just when you hear uge hahari nini dena fata nini dena dena, talk to your boss. Let that boss, you never know, boss you no ko waga kumwira na corona no korwo ahota gũkorwo nĩ onake nĩ athia dialysis na ndarĩ akwĩra, kana hena mamu wao kana baba wao kana mũndũ oĩ a loved one that going through dialysis, or somebody who has not even gone through dialysis, mũndũ higo ciake they have failed, you know, nĩ harĩa marerwo atĩrĩrĩ, you might be starting, nĩ ũkwanjĩrĩria dialysis. You never know, that boss might listen to you na akorwo no gũgũthikĩrĩria, nĩ agũkũhota gũgũteithia how to maneuver, how to work your schedule, figure it out, you still remain active. Because me nĩ njĩtĩkĩtie as much as it's hard gũkorwo na mũrimũ wa higo na gũthiĩ wĩra, to me angĩkorwo wĩra ũcio ũkoragwo, although you don't need that another added stress, no angĩkorwo harĩ wĩra ũcio ũrahota kũruta ũgũgũ take your mind out of gwĩciria ũhoro wa ati I have to be on dialysis now, my kidneys have failed, I have to do this, I have to do this. That one day ũgũthiĩ wĩra or focus in that spreadsheet or focus whatever you do, that it gives you life without just thinking. And also you feel like you are a contributing citizen. I'm still active. Hey, today naenda job, you know. It still makes you feel where you are still there, and you know, and it'll be easier for you to even overcome. Also, okorwo wĩ ESRD patient kana mũndũ wanyu, mũ encourage aigire a support group, tondũ maigire a support group, those support groups help andũ kwaria makaiga, you know, this is what I'm experiencing, na rĩngĩ ona no ko mũndũ ndaoye ona ndarĩigwe depressed, but then them go to those support group, na hĩndĩ ya mathiĩ support group, and especially now like in African countries now with the uria adu WhatsApp, you don't even have guthi he mundu muikare ati mutugane handu hana. Most of the time it's a WhatsApp group, haria mwa form that support group in a WhatsApp group, na inyuothe ni mukwanjia kurania ciuria, mundu ni athire akuiga atiriri, oh ni thire dialysis, this is how my dialysis is going, mundu ungi akoria, oh how do you feel, ni ndiraiguona. And make sure always speak about it. Like warie ndukanecirie ona kaundu ni kariku kanini, ndukanecirie ni karia kanini, tondu ona kau kanini kahota gugatuika ana blown out depression utakumenya. And the other thing, like I said, speak to your family members. Make sure you advocate for other people. If you've been away in your dialysis patient, your ESRD patient, advocate for those people and for yourself. Na Gukoruo, where we na mũndũ wanyu na mũrimũ wa dialysis wa kidneys, kana urutaga wĩra na andũ mena mũrimũ wa kidneys, you're also their advocate. Like ũrĩa makwĩra, listen keenly and make sure you help them, let them get diagnosed. Ndũkanaignore na kaũndũ kanini, kaũndũ kau, ask question after question after question. Mũndũ akwĩra atĩrĩ, akwĩra I was feeling this, ũkamũria when did they start, niki kura happenete, niguo wigu did you umuria ni hari undu ungi urathiete niguo uhapeni ithiete kahinda kaigana, waigua uri ni hari undu wikite wa guguteithiriria kuririfu uri uraigua. You know, if somebody is saying I'm feeling anxious, ni ukomuria ati niki kira trigger anxiety yaku, niki irambiriirie ha, ni wikite undu ugateithia uka reduce, tondu no uria mundu ati if it's anxiety, what do you like to do when you feel stressed out? Mundu ngino yate I like to read. Oh, you ukamuria, okay, well, which book are you reading right now? Ni ibuku ririku urathoma thaa ici? And then mundu atakuga atiri, oh, ndiena ibuku ndirathoma, then you can suggest, no, suggest mundu mwire atiri, actually right now he ibuku riri ndirathoma. And if somebody who like reading, share the book, mutigeshare ibuku, ndugeshare ibuku nake. Oh, umwire, hey, I'm going to the park, ni tureciria guthie, you know, hehana turathie, you know, this wedding invite that person, and probably that one you see whether you help reduce whatever if it's anxiety, see kana kuri undu igiteithia. If you are a family member, if you are a caregiver, kana nurse, doctor, I can only speak for nurses, social workers, patient technicians, ask those patients, is there anything I can do? Try to brighten, draw something for the patient. You know, mushorera cartoon how I always draw flowers. Dikora what modo I was sure I did it. I'm not an artist, but I need joraga kaudo. Get a modo here, almost the good there. I tell them like that's the you know what what I like a Swahili word, and I tell them this is your Swahili word to learn for the day. Now go to work next time walk I want you kojaridia kana kojiro, you know, a Kikuyu word, and that's the day. Maguti damagi practice how, and that brightens them, you know. So there are so many things we can do just to see kana that help really, you know, to find out the triggering, asking the why, you know, all those things, you know, when did it start, you know, what triggers it, how you do it, assist. I thank you guys. It's a 40-minute video, but I appreciate if you guys can listen, because depression ni moigwa, depression ni nyitaga andu aingi muno aria mena murimu wa higo, na unfortunate na gai andu a higo matimenyaga andu aingi matimenya mena murimu wa higo until it's too late. Then you kaigua depression na yanyita andu a higo matimenyekaga until it's too late. Na nikio turoka kwari uhoro wa depression na andu a higo, na nikio ndehaga uhoro wa murimu wa higo na andu kumenya uhoro wa higo. Uria higo, they play an important role, and the more we talk about it niguo tukuhota gwitikira care ya ithui na ati higo tohoro ati treatment is not all about igutwika guthie dialysis. No hari maundu mangi tungika ona tutanakinya gutwika guthie dialysis, kana ona hindi ria twi dialysis ri tungika atia niguo tuhote gutwika ni turari a thriving life, and na life iria ni turakena ni maisha maria tuhetwo just gukira na kuona the next day. So I thank you again. Thank you for watching this video. Make sure newa subscribe. Derutira, you subscribe and click the thumb. And then, by the way, if there's anything you'd like me jariredia, I take time to research, to read. I give you guys live examples of what I see and what I have seen and what I do. But I also make sure I'm reading different places to find exactly about topic here. Sometimes I try to break in short, but if you have any question, please ask on the comment. Also like it, you know, press the like button, and anything, you know, if you want us to form a support group, I'll be happy to form a support group. Hari adu no turanie shiuria no to shokaniririe, and then anything that you feel we need to talk about. The next channel, I will bring another topic soon. If you have not watched ewegia uhoro wa kidney donation kana uria yetagwo kidney transplant, please check the other videos up here or in the description. I have another video about kidney transplant. And if you follow me, Nasu Mwangi at Fight for Kidneys or Nasu Mwangi, that way you find me and just watch a video and need you gaga, even if it's a few those that at least watch all of it. But kauruko wathoma kanini oko no iwa kiugo depression na mundu wina murimu wa higo, please ask mundu ucio wi muhawi ni uyu horo wa murimu wa higo na ati no twike depressed. Me, that's all ndiramuri ati waigua uria mundu ungi na niguo mundu ucio ngiamenye naguo tungithi tugispreadaga the news na tumenye how to take care of ourselves, how to give the people we love kana andu aria twendete tumahe a thriving life by making us involved, by being advocate for them. And that's why I do these videos out of love. and I say this from the bottom of my heart, educated all areas of nursing, but I have done different ones. But if there's one job that gives me the most satisfaction, nagaigwa I'm doing something in this world, Gukoruo I take care of the ESR patient. Aduaremarathi through dialysis, that I take care of them. Now, it's not just at the nidira provided that treatment. It's what comes out of me, the encouragement that I give them. That laughter, that smile, on a daily basis, the joke that I give them, the hug that dahemodo, that to me, I feel, they feel respected. To me, I feel I have added the next dama adra mudenyo gemweru. And to me, I'm always about providing, making sure at everybody who is ESRD patient, kana dialysis patient, kana mundu ina Murimu Wahigo, niaragia the best care, niara receive quality care at affordable rate, or receiving quality care at affordable rate. Not that where people taking advantage of the ESRD patient, they are being charged so high and they are not receiving quality care. So quality care is the most important thing. Is that person receiving quality care? Are they treated with respect? Are they taken care of? Oria nie igieda krone nie taken care of? Kana krone nie family member wakwa kana mundu uria nyendete agikorwo niara akenidi ena Murimu Wahigo niaragia na care iria agienda niaragia na care iria yagereire. And that's where I come in and I'm like, I'm so happy that every day I go and I smile, and I enjoy every single day that I'm with those patients. It's nursing, it's hard, but I enjoy it, and I do it with passion. And anybody who knows me, I'm doing this out of love, out of joy, just kumenya ati dakwira nyoguthie wire mundu ungi na tuthie tuki-educate, because you never know, today it could be somebody else, the next day it could be you. And if you know, then next time you'll be like, it's those things, you'll be sitting there and you're like, guy, thank you, need video. And if I say something, hey, I start to be corrected. If there is something and that didn't somebody is like question it, please ask me. And I'll be right here to say, hey, yeah, that one, I'll check it again and say, probably I put it the wrong way, but I thank you, and I thank you guys from the bottom of my heart. Thank you muno ni undu wa guka ku watch na gutuika my regular followers. Until next time, take care. Bye.